In this video, I'm going to talk about how decompression therapy can help back pain. It's something that's searched a lot on the internet, and we get a lot of questions from prospective patients asking about how it can help their particular case. And understanding back pain is really important. If you've seen any of our other videos on things like slip discs, herniated discs, and a plethora of other conditions that can lead to back pain, you'll understand that back pain fundamentally, in the overwhelming majority of cases, is caused by a failure of your back, your spine, to deal with the compressive loading of gravity. And that can either be a one-off event, or it can be done consistently over a period of time, and it's caused the discs and the joints in the spine down here to start to wear and become symptomatic and give you pain. Decompression therapy is doing exactly the opposite of the compressive load that you're putting on your back on a daily basis, and it's essentially taking these little discs and stretching them out, taking the pressure off them. Now, the disc should occupy a specific space in between these two vertebrae, and if it occupies that specific space, it should have a specific height to it. And if the height drops because there's too much compression, it's natural that the disc, because there's a set amount of material there, will bulge out towards the side. And by stretching it back out again, you get a decompressive effect here, which pulls the material back towards the center, relieving some of the pressure on the nerves and decreasing levels of inflammation. It also helps with nutrient exchange within the tissues as well, which is another benefit we don't need to get into here. But fundamentally, it's a very helpful treatment to actually take the pressure off those discs. Now, in the clinic here, we use it in conjunction with other therapies to make it even more effective. But it is critical in most patients to have some element of decompressive effect through treatment, because that's helping oppose the pressures and the stresses and strain of daily life. So in our opinion, decompression is a fundamental block of any treatment for back pain and neck pain as well, providing there aren't any contraindications, which will be assessed on an individual basis. But we generally test thoroughly when a patient comes in here to check their suitability for decompression therapy, how we should do it specifically, what angles should we be pulling at, should we be doing on the front, on the back for the patient, and making sure it's as targeted as possible to that individual with the right pull cycles, etc., to make sure that decompression can really help that lower back pain. Thanks for taking the time to watch this video. We hope you found it useful. If you've got any questions, then comment below and we'll be sure to answer those as helpfully as possible. And there's some interesting videos here and here for you to watch, so click those if you're interested. And don't forget to stay up to date with all the latest notifications and videos and uploads. Subscribe by clicking above. Thanks for watching.